sometimes can make the situation worse rather than better. Especially if it's a corrosive poison or something, then it could really do more tissue damage coming back up. Never give this without an order. Activated charcoal binds with the poison, neutralizing it. Gastric lavage is when we fill the stomach with water and then we suck it back out. And then cathartics, that increases elimination of a poison through the bowels. And antidote and antagonist, we don't have a lot of these available. Honestly, a lot of poisons just have to work themselves out of the system and we just have to treat what's going on accordingly. So others with those treatments, we may need to give anti-seizure medications, anti-dysrhythmia medications. Hemodialysis might be needed, diuretics might be needed, transfusions, those kinds of things for other treatments. Okay, acetaminophen poisoning. This is usually caused by an accident. This is giving too much over an extended period of time, and it's just mismeasuring or not knowing the weight or reading the chart wrong. Acetaminophen used to be given at different concentrations. It's not so much anymore. So that's really eliminated the problem. And then we have, the medications that also contain Tylenol, a lot of cold medicines and hydrocodone, things like that. And so people were doubling up. And then we also have, trying to commit suicide using this medication as well. So that's when we see a lot of it hit at one time, then we know that it's probably a suicide type issue. This medication is metabolized in the liver, so it causes hepatic destruction if overdosed in it. Activated charcoal is used for a treatment as well as a medication called Mucomyst, which is a decongestion, but it works great at preserving liver function. Signs and symptoms are going to be some CNS symptoms, restlessness, agitation, seizures, and coma even. Respiratory complications can be obstruction, hypoventilation, hypoxia, respiratory arrest, and needing CPR. Cardiovascular system difficulty in maintaining electrolyte balance, increased blood urea nitrogen and increased serum creatinine, increased blood glucose, and these people should be monitored by telemetry. GI would have difficulty swallowing, abdominal pain, and possible gastrostomy tube may need to be placed. Kidneys, specific gravity. Urine, we're going to watch that and look how the kidneys are filtering out, maintaining good INOs, and need IV access. Of course, an RN is going to have to do that, but we're going to be assessing that IV access. Methods to increase elimination, so a cathartic, forced diuresis, dialysis, or hemoperfusion may be needed. Hypo or hyperthermia can happen, so we're going to treat that accordingly. There may be a lot of guilt, anger, or family dysfunction with this. Guilt because, maybe gave too much Tylenol. Anger, if this was like a suicide thing or a family dysfunction. Oops. The next one is aspirin poisoning. This salicylate is also another word for aspirin. It's an ingestion of about 1,500 milligrams for a 22-pound child. Treatment is going to be vitamin K to help with that clotting, and then sodium bicarb by IV route is also going to be used in order to, keep the person out of that metabolic acidosis state. Peritoneal dialysis or hemodialysis may be needed to remove that medication from the bloodstream. The bad thing about aspirin is even though the onset is very quick, it is excreted very, very slowly. So symptoms may not arise for quite a while after taking it. It's more of a cumulative effect rather than, taking too much and then just like boom, hitting with the symptoms. It just kind of keeps getting worse and worse and worse and more profound. Lead poisoning. This results from repeatedly ingesting or absorbing substances that contain lead. Primary sources are going to be old, deteriorating buildings, the paint chips from those. And then there's also been a lot of reports of, toys coming back positive for lead, different plates, other serving dishes, that kind of thing. So it is important to, especially if you're importing from a different country, to have those tested. Most common ages are going to be 1.5 to 3 years because this is the age where they are putting everything in their mouth and they're putting their mouth on everything. So that's how they get that ingestion of it. Okay, manifestations. These are going to occur gradually and range from mild to severe. Initial signs are going to be weakness, weight loss, pallor, irritability, vomiting, abdominal pain, and constipations are going to be anemia, and then nervous system involvement can cause encephalitis that may be fatal, which is swelling of brain tissue, and then lead encephalopathy is irreversible brain damage that is caused by this. It's a loss of developmental skills, having attention problems, hearing loss, kidney damage, reduced IQ, and then slowed body growth. Here's another picture: brain nerve damage, hearing problems, digestive issues, and stunted growth. We're going to assess the blood lead level. This is recommended on every kiddo at 1 year of age. And it is by law required to go to school. Use lead-free paint when, painting toys, furniture, or anywhere inside the home. Poisoning may be acute or chronic. We look at a history of pica, which is the eating of things that shouldn't be eaten. And then to treat it, we use chelating agents. So chelating are going to bind with the lead and then make it unusable. We talked about this with iron. That's why we don't give iron with dairy, because iron will bind with calcium, making it unusable. So EDTA or BAL are those agents, and the treatment can take several months. Here's another slide that shows a lot of just interesting facts about lead exposure, and then having paint tested for lead is actually really easy. It's a marker, and if that marker turns a certain color, then it is positive for lead. It dries and then it's invisible, but that's how they can easily test things for lead. Okay, we're going to move on to bacterial meningitis. This is inflammation of the meninges, which is the covering of the brain and spinal cord. This can be caused by various organisms. Bacterial meningitis is going to be caused by bacterial. This is usually more severe than a viral meningitis. Organisms usually invade the meninges through the bloodstream, so like having sepsis, having that infection present in the blood. Infections that commonly cause this are going to be teeth, sinuses, tonsils, lung infection, and ear infections. May also have like a protrusion through the skull, like a fracture from trauma. May cause hydrocephalus. Peak of incidence is between 6 to 12 months of age. Etiology is the biggest one is going to be the Haemophilus influenzae. This is the Hib vaccine. You can see right there. That's why we give the Hib vaccine. Other things that can cause it: E. coli, Group B strep, which is, something that we test the normal flora for before a mom goes in and has her baby. And if she tests positive, we give her antibiotics during labor and delivery to help prevent this and pneumonia. And then there's Neisseria meningitis and Streptococcus. Okay, Neisseria meningitis is spread by contact and extremely contagious, especially in school and military settings. Close contact with a patient with meningiomensemia will result in you needing prophylactic treatment. The medication they use for that is rifampin. Very important to educate that rifampin colors urine, sweat, and even tears a blood orange color. So this will even stain contact lenses. So it's recommended that you wear glasses during this. Diagnosis for this is going to require a lumbar puncture, which is where they take a sample of the cerebrospinal fluid at the lumbar spine. Isolation precautions are going to be needed. We're going to be, and it depends on kind of what is causing the bacterial meningitis. I've got just kind of a big list here. Usually it's going to start out like a respiratory infection, and then GI symptoms, and then poor appetite, and then things continually grow in severity. We could have intracranial irritation, severe headache, drowsiness, delirium, irritability, restlessness, fever, photophobia, vomiting, nuchal rigidity, which is going to be key to meningitis. This is stiffness of the neck. They're not going to want to move it side to side or touching their neck to their shoulder or their head to their shoulder. Infants are going to have a characteristic high-pitched cry. Like I said, convulsions, coma. We're going to talk about, I got a picture coming up of Brudinsky sign right there, which is flexation of the head causing flexion of the knees and hips. So when you move the head up, then the person automatically wants to bend their knees, move their feet closer to them. And Koenig sign is pain with extension of leg and knee. So often these are going to be involuntary because it's the body's way of trying to maintain the inflammation that is lining their brain and spine. There's a picture of that Koenig. So here's another picture, moving head up, and then that causes the knees to bend, right? And then if they extend the leg out, then it causes pain. Okay, this is the very classic positioning of somebody with meningitis. Babies especially, you're going to see the C bend, C shape of the spine here. And that's because the spine wants to shorten as much as possible because of all that inflammation. The shorter the spine is, the more comfortable the person is going to be. So, you know, for somebody that's older, this is the person that has a bunch of pillows under their neck so that their neck is bent way back, their head is bent way back. And that's just because it's going to be more comfortable that way. A petechial rash can suggest a meningococcal infection. A rash with petechia that develops in a child who is ill or lethargic may be referred for immediate follow-up care. So diagnosis is going to be a history and physical, lumbar puncture for culture sensitivity of spinal fluid. We're also looking for, white blood cells. If we see white blood cells in cerebral spinal fluid, we know there's an infection, right? We look for tense bulging because it can cause hydrocephalus, so tense bulging of fontanelles, high temperature, that they're very sleepy and lethargic, vomiting and refusal to eat, so lack of appetite, irritable when picked up, high-pitched cry, fast and difficult breathing, extreme shivery, blotchy skin. Remember the petechia rash, the pinprick rash. Body movements are going to be very stiff and jerky. Sometimes diarrhea, and hands are going to be cold hands and feet. You could have that anyway, but this is going to be like a perfusion issue. So here's a chart that shows like differences between babies and children and then adults. You can pause and take a look at that. Nursing care of somebody with meningitis. So we're going to keep the environment very quiet. We don't want the kiddo to scream. We don't want them to be very anxious. We want very calm, soothing environment. We want to be able to control that fever. We're going to look at INOs. We want to prevent dehydration and overhydration. We want to assess neurological function. We're going to assess for intracranial pressure. Isolation until 24 hours after antibiotic therapy has started. Medications are going to be ampicillin, aminoglycoside, and penicillin G. And really, keeping the room dim and quiet is going to be key. Okay, viral meningitis signs and symptoms are going to be headache, fever, malaise, GI symptoms, abdominal pain, nausea, vomiting, and signs of meningeal irritation. So the onset may be abrupt or gradual with viral meningitis. They can get back and leg pain, sore throat, chest pain, photophobia, muscle aches and pains, and a macropapullar rash. Symptoms usually subside spontaneously and rapidly in the child as well within 3 to 10 days with no residual effects. Diagnosis is based on clinical signs and cerebral spinal fluid findings. May need to differentiate between that and the more serious bacterial meningitis. Treatment is just going to be treating the symptoms. If they're having a fever, we're going to treat the fever, things like that. For viral, it tends to be less severe than bacterial.